VRD or Bortezomib, Lenalidomide, Dexamethasone is the most common regimen used for frontline therapy of multiple myeloma, both for transplant eligible patients and non-transplant eligible patients. When Bortezomib was first introduced, it was used intravenously and twice a week, which led to high rates of neuropathy. About half of the patients would get bad neuropathy. And we've learned over the years that giving it subcutaneously and once a week retains its efficacy, but decreases the risk of neuropathy to 1/3. But even in the once a week Bortezomib regimens, some of the regimens are given on an every 3-week cycles. That was how the clinical trials were conducted, in which the Lenalidomide is given on days 1 through 14 with a 1-week break. And some centers use for convenience a 4-week regimen in which the Lenalidomide is given days 1 through 21 with a 1-week break. The Velcade is every week in both of these regimens. What we wanted to investigate was whether there is any difference in the two regimens in terms of efficacy or toxicity. So we looked at patients at Mayo Clinic undergoing real-world treatments outside of clinical trials, whether they received every 3-week regimen or every 4-week, and many times it's decided by the patient and physician preference. What we found was that, encouragingly, there was no difference in the rates of hematologic response in both groups or progression-free survival, and toxicity was also similar across both groups. This is encouraging to see and gives the patients and their physicians freedom in choosing the regimen they want. Sometimes an every 4-week regimen is more convenient for patients and physicians, so it just tells us that both are equal and we can choose the treatment we wish for our patients.